So Mike, how's the pandemic impacted your business? I'm sure it has. And how have you provide services to your patients through this crisis?
Yeah, it sure has, Bo. And just as it's affected, I think, most healthcare related companies. And we've seen impact across both of our sides of our business, our acute and our chronic side. As you can imagine, with the pandemic, fewer people are actually going into having, for example, elective procedures. And so a small portion of our business is tied to therapies that are associated with elective procedures. So as people are putting those off, we're seeing fewer of those patients. We're also seeing as hospitals really geared up to handle the pandemic, really helping to move patients, non-COVID related patients out of their hospitals, and focusing on that part of the business. We saw again with some acute business, a bit of a dip there. Now, the fortunate thing is hospitals are opening up again. Some more of the elective procedures are happening. But we also did see with our chronic patients, these are the patients that have long-term disorders and require long-term treatment. We saw some people going to their physician less with that, again, just out of concern for the pandemic. So we saw a little bit of a dip there, but again, we're starting to see that business come back. We obviously also incurred additional costs, as a lot of other companies did, as we had to scurry quickly to acquire and procure a lot of PPE for our caregivers as well as our organization there. But I will also tell you, Bo, it's really challenged us in some productive ways to think about how we need to do business differently, leveraging technology and the like, and be glad to talk more about that. But we obviously did see some impact, and we'll have to see, particularly if we feel a second wave is coming up here in the future.